Consider this: 80% of the population will experience back pain in their lifetime, of which 20% will become chronic. This 20%, however, makes up 80% of the costs, ranging between $80 and $100 billion each year. Chronic neck and back pain is the second most common reason to visit a physician, after the common cold and the number one reason for missed work days. People suffering from acute and chronic pain have tried exercising their back muscles at their local gyms, done sit-ups, and a variety of other things. While these activities do have some benefit, they do little, if anything, for strengthening the muscles of the lower back. Progressive exercise is only helpful if it's done with the appropriate muscles. We emphasize the importance of strengthening the neck and lower back extensor muscles. When back and neck muscles are exercised, the healing process to these areas is greatly enhanced. As long as the pelvis is free to move during exercise, the larger hip and leg muscles are the ones performing the work, while the lower back muscles become weak and inactive. This is why it's so important for our patients to exercise in this unique way. Let's look at a side-by-side comparison on the effects of pelvic stabilization. On the left, hip function is demonstrated. Hip function does very little for the lower back because without pelvic stabilization, larger muscle groups such as the hip flexors, thighs, and hamstrings take over and perform the work, leaving the lower back muscles weak and inactive. On the right, lumbar function is demonstrated. Notice the difference in the lack of pelvic rotation once the pelvis is stabilized by the Med-X lumbar extension machine. The low back muscles are forced to do the work without the assistance of the larger muscle groups. Another benefit is that correct exercise enhances the transfer of nutrients to the disc. This keeps the disc hydrated and supplies it with nutrients and water that are essential for the general well-being of the disc. Exercise of the extensor muscles also makes the vertebra stronger, as well as the connective tissue, such as ligaments and tendons.
Pure HealthyBack is providing health plans, employer groups, and consumers with a non-surgical treatment for chronic neck and back pain. Each center has the unique combination of highly trained physicians, exercise physiologists, aggressive medical exercise technology, and one-on-one coaching that is proven to deliver immediate impact to patients. In the Pure HealthyBack program, patients go through 10 weeks of intensive treatment, followed by 9 months of maintenance. During that time, they are equipped with home maintenance tools and motivated to take responsibility for their own health care and well-being. Unlike traditional back pain programs, patients in the Pure HealthyBack program find lasting relief and get off the medical merry-go-round. The number of expensive, unnecessary, and often unproven treatments and procedures, including surgeries, is often eliminated. WellTek is opening multiple Pure HealthyBack centers across the country. For more information, visit the WellTek website at www.welltekinc.com.